Well, hey folks, thanks for joining me on today's Transplant Helper Quick Tip. Today's quick tip has to do with heart caths and biopsies. Now, if you're a pre or a post-heart transplant patient, you've already endured a many a biopsy in your life, so there's not a whole lot I can tell you about the procedure itself other than to remind you that it comes with a lot of anxiety, a lot of stress, many times a lot of discomfort and pain while you're laying on that cath table in the lab. And oftentimes that comes because you're given very little sedation, if any sedation at all, and it oftentimes comes with just a local anesthetic. Now, whether going through your groin, through your arm, or most likely post-transplant going in through your neck right here to receive those biopsies, you want those things to go as smoothly as possible so the doctors can basically get in and get out. That's at least what my goal is in the cath lab, is to get it over with so I can get up and get out of there, right? Is that not how you feel? Now, I want to give you a tip that I think is going to help you to do that more times than not, and that's simply to be sure that when you go into the cath lab, you're extremely hydrated. You say, Jim, why is that? Well, if a doctor goes in to do a heart cath, and this could account itself for even going in for simple blood work, but if a doctor or some sort of technician goes in to perform a cath biopsy type procedure, when they go into those veins, those vessels, those arteries, whatever it is, they need those veins, vessels, and arteries to be dilated and not constricted. And when your body is low on hydration or dehydrated, it makes those vessels and veins constrict. Therefore, it makes it more difficult for them to get in where they need to get and to move through and pass through those areas where they need to be. So what you need to do to prepare yourself best for any type of cath procedure is to be sure that you're well hydrated going in, henceforth making those things dilate or making those things swell so that they can move through more easily and or more quickly. Therefore, you're more comfortable, right? Now, you might argue with that and say, well, wait a minute, Jim. Most times when I go in for a cath and or a biopsy, they tell me I'm supposed to be NPO prior to the procedure, particularly and usually maybe after midnight. So about 6 hours before the procedure, you're generally put on an NPO. That means no liquid, no food past this point. And yes, that's true. And by the way, you need to stick by that, because if they make you NPO and you go against that, they're most likely going to find out and they're going to cancel the procedure. So stick by that. However, what I generally do when they make me NPO after midnight is I'm willing to stay up until midnight, not only get that last bite of food to make me comfortable, but especially so I can be hydrated. I'm drinking water, cups and glasses and bottles of water all the way up until midnight to be sure that I'm well hydrated for the next day. Again, I won't go past that midnight or that cutoff time, but I want to be hydrated for the next day. So, oftentimes there's some anxiety and some anxiousness anyway. I'm probably not going to sleep well, so why not take advantage and be prepared for that cath? Now, this has just been a quick tip for today. If it's helped you out in some way, why not hit that like button, subscribe, or share these things with your friends. I'm the Transplant Helper, and I want you to just stay stronger, friends.